Boom. Hey, what's up, folks? Dr. Dan in the house. Finally, get to jump in and do some YouTube action. Welcome, folks. It's a pleasure. I sort of feel like I'm in the therapist seat here, just unloading the stuff that's on my mind. And today, no exception, I get to talk about some really, really good stuff. Very important. Not necessarily just cannabis news directly, but today I want to talk about a very important subject regarding this class of medications called benzodiazepines. Okay, you guys might know these drugs. They're commonly used to treat anxiety and insomnia as well. You probably know them as Xanax, Valium, Restoril. If you're familiar with their chemical names, they go by diazepam, clonazepam, temazepam, the azepams. Okay, so what's interesting is I came across this very interesting article in Neuroscience News this week. This was just published, hot off the press. Okay, that these benzodiazepines, this class of drugs, causes neurodegeneration. All right, loss of the neurons. Particularly, they clip off the ends where the neurons meet and talk, where they communicate, what's called the synapse, where they exchange information. What happens, this class of drugs, it binds to a receptor, okay, what's called a translocator protein. It binds to this receptor on this cell called a microglial cell, and it activates this cell to degrade, to destroy these nerve endings. When you destroy nerve endings over time, folks, what you get is neurodegeneration and eventually cognitive decline. Okay, that's important. This cognitive decline, this is the thing that underlies, a series of neurodegenerative disorders, namely Alzheimer's, dementia, the big thing. And this is important stuff. So just a little bit of background on this study. This was done by a German group. This was done by a German research group, and just recently published their results. Namely, this was done by the German Center for Neurodegenerative Disorders. All right, so they came across this mechanism by which this class of drugs goes on to degrade this synaptic terminal. And again, long story short, the chemical benzodiazepine, whichever one out of this class, the chemical binds to these cells, these microglial cells that reside in our central nervous system. These are immune cells, all right? So their job is to clean up inflammation, and what they do is just basically a bomb job, and anything that gets in their way, just as a defense mechanism, they just blanket destroy. So that's what they do to nerve endings, all right, once they're activated. And the benzodiazepines activate these microglial cells to destroy the nerve endings. This is shocking. This is big news, folks. It's really surprising to me that this sort of stuff doesn't hit the public at large and medicine at large in terms of taking heed regarding using these drugs, because we prescribe these drugs widely. I don't. I prescribe medical cannabis, and I'll get to the medical cannabis part because, medical cannabis, it's an alternative to these medications. I want to sum up something that these researchers who conducted this study, want to sum something up with what they said, how they closed this study out. So the authors concluded, and I quote, drugs that are known to have no binding affinity to this translocator protein, which resides on the microglia. Drugs that have no binding affinity to these microglia should be preferred when possible. Period. End quote. All right. So that's the researcher's statement, not mine. Okay, their words, not mine. So I think that's a perfect segue. Cannabis does not bind to this translocator protein. Okay, I talked about this in one of my previous videos. I'll try and hunt that video down so I can go into it more in depth. But I think the salient function here, folks, is really that cannabis does the exact diametric opposite, the inverse of what these benzodiazepines do, at least from a neuronal toxicity level, right? I brought up this idea of synaptic plasticity, meaning that the synapses are fluid and in flux in terms of learned behavior and learning how to adapt at the nerve level. Cannabis does this by turning off that microglial action to degrade the synapses. What cannabis does is it actually builds synaptic connections and enhances the synaptic activity between two nerves. Okay, no toxicity of the type that's described here for benzodiazepines. As a matter of fact, it's trophic. Trophic meaning promoting of life or tissue preserving. All right. Cannabis is trophic to the nerve endings. This is huge. Cannabis falls right into that class of drugs that these researchers are talking about that don't bind to that translocator protein, thereby activating the microglia to destroy the nerve endings. Okay, that's really the long and short of what I wanted to talk about today in the 420 Livecast. All right, that's really, really important. What's happening, folks? I just want you guys to see the trend of what's happening in medicine slowly but surely as we get more good information and more of these peer-reviewed journals being published. We're finding that the things that physicians are prescribing, we're finding more and more the pitfalls that come with them. And little by little, we're finding that it's okay to lean on natural remedies and still ensure quality of life years for patients. And I'd invite you folks, if you're curious about some drug that your doctor is prescribing, I'd invite you to just ask them what the long-term effects are, right? That's really, really the discussion. Whether or not someone is into cannabis as an alternative treatment, we can see pretty much right here the pitfalls of treating anxiety and insomnia, common things that we treat in the clinic, both the cannabis clinic and primary care clinic. These are common and pervasive diagnoses. All right, these are chronic conditions. So the idea of long-term use of benzodiazepines, which can cause addiction and cognitive impairment, mental dulling, slowing of the mind, that sort of thing. This is just part and parcel of this sort of action, how it destroys nerves. Okay, so I think it's important for people to have their eye on the long-term consequences of taking prescriptive pharmacopoeia and imploring their physicians to do their research and tell them what the possible poor outcomes can happen. This is standard talk regarding risk and benefit, folks, when we're starting a new medication. So that's really the sort of thing I wanted to dig into today. I wanted to give you the short, quick hit just to open up your mind that, a lot of the stuff that we do in regular garden grade Western medicine, a lot of it can come with dangerous pitfalls, and these pitfalls are not always discussed by physician provider to the patient. So I wanted to just give you guys that little nugget of wisdom so you could have it in your armamentarium and just keep it in your pocket, because folks, I don't want the public to go down a road where they're being misinformed. The best thing that I can do as physician is not prescribing any particular thing, even cannabis. Cannabis is great, and I always laud its uses and its promise as a natural medicine for treatment of symptoms. Not really so much for the curing of disease for the most part, but just treating of symptoms. Where a lot of Western pharmacopoeia fails. But more than anything, it's the information, folks, that I can impart onto the public at large so that they can make the best decisions for themselves regarding their long-term health. What we're trying to do in medicine is get a public that enjoys the longest quality of life years, right? So that's really the best that we can do. And I just want to do my part and give people the information so they can know their options that are ahead of them. And in some cases, cannabis will be a better option, and in some cases it won't. And I think in particular, when it's measured up against this particular drug class, the benzodiazepines, I think overall it's a better choice. The risk for those drugs, it's too high. Those are drugs that, in my opinion, should really only be reserved for, more urgent and emergent type situations more of an inpatient type thing. Using them long term, I think that's a thing that seriously the risk benefit needs to really, really honestly be discussed between physician provider and the patient. Okay, that's my 2 cents for this Wednesday, folks. Yeah, listen, nice meeting with you guys. It's always a pleasure. If you have any, don't forget to like, don't forget to subscribe to my channel. Always forget to mention that. Don't forget to like and subscribe. Also important, don't forget to share these videos, folks. If you like the videos and me making them, drop a comment. If you'd like something improved on the videos, guys, my ego isn't too high. That's a lie. Just let me know if there's something else you want to see or you want the videos done differently. You know, we're a patient-centric company here at Ozark MMJ Card, so I really just want to deliver what the patients are looking for. Guys, always nice meeting with you. A pleasure, okay? Dr. Dan, be well, all right? Out, guys. Love you.